Good morning. I am Christine Trevino, and I'm going to be assessing a hair, skin, and nails assessment. This is my note card that has all of my items on it, and this is my helper. Good morning. I'm Christine. I'm going to be your RN for today. Can I please have your full name and date of birth?
Queen Elizabeth.
All right, Queen Elizabeth, what's your date of birth?
Date of birth is May 26, 1954.
Perfect. So today, Miss Queen Elizabeth, what we're going to be doing is a hair, skin, and nails assessment. So what that means is I'm actually going to be visually inspecting your body, but I'm also going to be touching, palpating, which is another word for touching, just to make sure that everything is okay, to see if there's any irregularities, anything that we would need to look at further. Do you have any questions?
No, ma'am.
All right. Give me just one moment, please. I'm going to go wash my hands and prepare for the inspection.
Okay.
All right, Miss Queen Elizabeth. The first thing that I'm going to do, I'm just going to ask you to look straight.
Okay. Straight this way.
That's perfect. All right, yep, so just look straight ahead, and I'm going to just kind of look at your hair. Looking at Miss Queen Elizabeth's hair, it is, the color is brown. I'm going to go ahead and I'm going to touch your hair. Her hair is also a little bit gray underneath. Her hair is evenly distributed. I don't see any balding spots, any thinning areas. I also don't see any kind of irregularities. There's no scaling, no kind of rashes. There's no dandruff. Everything looks nice and even. I'm also going to check the back of her head for any pressure points, any areas that could possibly cause concern for later. I don't see any. I also do not see any rashes or irregularities. Her skin tone on her neck and the top of her back also look even. Her skin overall has a pinkish brown to it. The second thing I'm going to do, Miss Queen Elizabeth, is I'm going to go ahead and assess your arm. So if you could please hold out your left arm. It's perfect. Her left arm, the color appears to be pink and brownish. The tuger is good. When I pinch it up, it falls right back into place. She does have some sunspots that are generalized on her arm, more primarily on the lower arm than the upper arm. I don't see any rashes. I don't really see any nevi, moles, any kind of scarring, scaling. Everything looks good. Temperature is warm. Skin tone is pretty much even. Her fingers appear to be a little bit pink. I'm going to go ahead and test that cap refill. The beds of her fingernails are pink as well. Cap refill is less than 2. Her fingers don't appear to be clubbing. They appear to be at a nice, less than 160-degree angle for her left. Her right appears to, skin temperature also is warm. Skin tone is pretty much even. Again, those sunspots are primarily on the lower half of her right arm. She does have some sunspots approximately generalized as well, not localized. That one's about 2 millimeters. That one's about 2.5. She also has a tattoo right here. It's probably about the size of the bottom of a ballpoint pen. Cap refill is also less than 2 seconds. Nail bed on this one. Nail beds are pink. And no clubbing on her fingers or abnormalities. All right, Miss Queen Elizabeth, with your permission, ma'am, I'm going to go ahead and I'm just going to raise your dress up just a little bit in order just to examine your legs. Are you okay with that?
Yes, ma'am.
Okay. Actually, Miss Queen Elizabeth, why don't you go ahead and stand up for me so we can do that. I'm going to stay down here just so I can look at your legs. But again, I am going to raise up your dress with your permission. And it's okay that we're videoing this?
Yes, ma'am.
Okay, thank you. All right. So on her left leg, she appears to have some varicose veins on the anterior lateral portion of her upper leg. Her skin appears to be a little more dry down here than on her arms, but I don't see any lesions, any silver on her knees or behind her knees. Hair distribution is even. Skin tone is warm, or skin is warm, skin tone is even on both legs. She appears to have a birthmark on the lower right side of her leg. It's about the size of a dime. It's got some hair growing out of it. Her toenails on Miss Queen Elizabeth, I'm going to go ahead and I'm going to drop your dress, ma'am. Go ahead and have a seat. And then I'm going to go ahead and I'm going to pick up one of your legs. Go ahead and give me that, your left leg. So on Miss Queen Elizabeth's foot, can you bend your toes down? She is missing her big toenail. Did you have that toenail removed?
Yes.
Is it causing you any pain?
No.
Okay. It appears to be a little bit dry, but the nail bed is definitely missing on there. Other than that, her toes do appear to be a little bit dry as well. Her heel a little bit rough, a little bit coarse. Skin tone looks even though. Temperature is warm. Her cap refill is less than 2 seconds on that one. Let me go ahead and see your other one, Miss Queen Elizabeth. Thank you. So same thing on this toe. She's missing her great toenail. Her second toenail seems to be, it seems to have a little growth on it. It's a little bit thicker, a little abnormal. It doesn't look fungal, but it does appear to be a little more yellowish and raised. Her other toenails look okay. Her little toenail also the same thing. She's got some maybe calcification on there. Is it painful when I push?
No, but is that a problem?
No, that is not a problem. It's a normal variant, and then we'll go ahead and make sure we document that in your records.
Okay, thank you.
Right. And then her cap refill on this leg is less than 2 seconds, so normal. All right, go ahead and drop your leg down. All right, Miss Queen Elizabeth, if I didn't say it before, we have privacy in this room. I pulled this curtain to make sure that we're nice and private. What I want to do is, I understand that you're wearing a dress. I'm going to assess your back. I'm going to pull up, I would pull up your dress and I would assess your back because we would be in complete privacy.
Okay.
So I'll go ahead and for me and turn and face this way. That way we can see your back. Perfect. So we would brush your hair out of the way. I'm just going to go ahead and pull this down with your permission, ma'am. And so on Miss Queen Elizabeth's back, her skin is warm. Skin tone is even. She's got a couple different moles, nevi on here, along with some freckling. This looks like a cherry angioma. A couple of them, actually. There's about 3. I don't want you to worry about that. That's completely normal. Comes with age. We all get them. So same thing over here. Just some freckles, no spots that, no irregular borders, no kind of color changes. It's a variant of brown besides the cherry angiomas, obviously. But everything else looks good. All right, Miss Queen Elizabeth. Do you have any questions about your examination from today?
No, I don't.
All right. The last thing that I wanted to do is I wanted to look behind your ears, if you're okay with that.
Okay.
Just want to make sure that there's no abnormalities. Everything's good to go. On Miss Queen Elizabeth's left ear, she has a star tattoo on her ear, behind her ears. There's no scaling or pressure points behind there. Everything looks evenly distributed. Same thing behind this one. Her ear looks, there's no irregularities noted. No scaling. Her earlobe's a little pink, but I've been messing with it. So we know that there's good blood flow. Alright, and I believe on her face, just a little bit, she also has some aging spots, some sunspots. Again, completely normal. I don't want you to worry about that. Skin tone looks even. Her skin looks nice and pink. And it's also warm to the touch and even distribution. Thank you, Miss Queen Elizabeth, for letting me assess you today. If you have any questions or concerns, please always feel free to call my office or schedule a follow-up appointment. Thank you.
Well, thank you.
I'm going to check my note card.
So we're all done?
The only additional thing that I would do with Miss Queen Elizabeth is after I touched her feet, I would have gone back and I would have washed my hands again. Thank you.